Good afternoon and welcome everyone. I'm Ranjit, President of Breast Cancer Welfare Association Malaysia. I would like to welcome all of you. This is the UNPAUSE Symposium, and UNPAUSE is all about metastatic breast cancer, where we want to make sure that we can live, embrace life, and continue to thrive during our experience of breast cancer. We have two very notable speakers, and we're very happy to have them. They have taken time off from their busy Saturday to be with us, to share with us their expertise. So the first speaker, I would like to introduce now, who will speak for 20 minutes, and then the second speaker will speak for 20 minutes. And please key in your questions in the chat box. If you cannot key in the chat box and you cannot find the chat box, you will be able to ask the question later when both speakers have spoken. And to let you know that this session is being recorded. And we will later on edit it and also put it on YouTube. I would like to introduce Associate Professor Dr. Chong Guan, who is a consultant psychiatrist at University Malaya Medical Center. And his topic today is managing emotional challenges and well-being. And this is all to do with us living with breast cancer and others with cancer as well. Now, without further ado, I welcome Professor Chong Guan. Please go ahead and start your talk.
Hi, good afternoon. Thanks, Ranjit. And I hope it will be helpful for you to manage your emotion and well-being, not just because of the breast cancer, but also during this critical period. So I think this is what I have shared with all of you. What is stress? I think stress is something very natural. We need it for our day-to-day living. Just take a very good example of this pandemic, COVID-19. I think in March, we were given the first opportunity to experience what is MCO. At that point of time, I remember a lot of my clients come and share with me, they feel they are so stress-free in their life. They have never in their life before they feel so stress-free. They can stay at home, no need to go to work. The whole city is so quiet, everywhere is empty, no traffic jam. So when that time, people feel it's a good experience to stay at home without stress. But this time, another CMCO, I start to have a lot of clients start to complain to me. They say every day they wake up, they are not sure when the MCMO will be lifted. They feel there is no direction in life. Normally, they need to be so busy, occupied with work. Now, every day is the same, repetitively the same. So when they have no stress, somehow they start to feel very distressed and very uneasy. So this is one of the good examples to tell you that actually stress sometimes is a good thing to motivate us or to push us to do things every day. So you can look at this picture. On your left-hand side, we call it a eustress, a positive stress. We need something called eustress to motivate us to do things every day. When you wake up, if you feel like the day is the same like yesterday and nothing to look forward, then you're lacking of something we call eustress. You don't have this positive stress. But however, if the positive stress is getting a bit overwhelming, over-exaggerated, and too continuous, then you become a distress, what we call a negative stress. When the negative stress happens in life, then you start to melt down, what we call burnout, or maybe you may develop some psychological condition. So this is another way to look at the eustress and how to become a distress. When you really have no stress, we call it a boredom, the yellow color area. Every day is the same, nothing to look forward. But a little bit of stress, your life will become a bit green color, so your performance getting better and better. But come to a peak, what we call you feel exhausted. If you're still moving on, you still carry on with all the stress, then you melt down, you will break down, then you develop the red color area. So you develop all kind of psychological or physical condition. So this stress curve always, we have to keep it in mind. The best is to keep yourself around the green color area, the green color area. That will be keep your performance going on, then you always look forward to different things in life. So there is these big 5 things that always trouble our health or our stress level. Of course, family issue, financial burden, relationship, intimate relationship or love. Of course, the last is your job, or for those who are studying will be their education. So very often we cannot run away from these 5 things in life. One of it somewhere somehow tend to be not in the balanced state and causes a lot of stress. When it accumulate over time, you push us over the border and become distressed. So some of you may ask me, how do I know whether I'm at the exhaustion or coming to the peak of the stress level before it become a distress? So these are some of the common symptoms or signs that you need to identify whether you are at the peak of your stress level. The first one on your left hand side on the top bar is you get irritable and angry fast. The more common term or more suitable term to describe is you become more sensitive. Your partner telling you or asking you a very simple questions, you find it very irritable, very annoying. People talking a little bit louder, or you see your children running around happily, also will make you very angry. Then you know there is something not right with you. You are become very sensitive, or you become nervous or anxious easily. You can't sit still. A small thing, people like to call you out, or just a phone call, an email, a WhatsApp will make you very nervous and anxious. You have trouble functioning in your class, in the workplace. Normally you can see it, open your computer, you can handle the email very well, you can handle your task well, but when you start to feel that you take a longer and longer time and you find your brain is very heavy to think, you know there's something going on. You feel overwhelming. Any single task while you're doing your daily chores, your boss just walk to you, tell you just to type this letter for me, you feel that I can't cope with it, I can't cope with it. Then there is some early sign of stress also. And also you may feel that you're very forgetful. When you go to office, you realize that you forgot to bring your laptop. Halfway in the dining table, you realize that you miss your handphone, and you left your handphone in the toilet or in the office, or when you type something, I can't remember what you want to type already. Then you know your brain is starting to get tired. Or sometimes it may change your biological circadian, so you may not eat well, or you will tend to overeat. Your sleep also, sometimes getting sleep a lot, sometimes you can't fall asleep, and subsequently you have a lot of problem in concentration. You feel very tired, you always sleep in the office or at home while you try to watch TV, then you fall asleep. And the last thing is you always feel very difficult to overcome your daily chores or daily trouble. So how do you manage this? How to manage when your stress level is building up? So there are 4 things maybe you should consider to do. First is to learn to relax. Second one is learn to balance. Maybe you learn to self-talk. Of course, the last one, try to solve the problem. So I will go through one by one. I hope at the end, either one of these way will help you to manage your stress and have a better well-being. The first thing is learn to relax. This thing I think is freely available and being commonly educated to the public about relaxation. The first one is called breathing. There are many schools that teach us how to do this relaxation breathing. One is called deep breathing technique. So the commonest use is the 4-7-8 method. 4-7-8 means you try to breathe in by counting 1, 2, 3, 4, and by holding the breath in your chest, and you start to count 1, 2, 3, 4, 5, 6, 7. Then you breathe out 1, 2, 3, 4, 5, 6, 7, 8. So that is called a deep breathing technique. Another school of thought will teach the breathing by using focused breathing. Means you are not doing the counting, but you try to focus on your breathing. you try to think about there is a lot of stress, a lot of tension in your chest, and you try to breathe out all your stress and all your tension. So when you breathe the time, you do very relaxing way and say, I breathe out all the stress. And slowly you try to inhale all the peace and calm. This is called focused breathing. Of course, focused breathing have been modified, and a lot of people nowadays doing mindful breathing. So the mindful breathing, I will spend more time in my subsequent slide to share with you how to do the relaxation. For the master relaxation technique also, I think you can learn this from online, YouTube, internet, where the online, they will teach you how to find a comfortable place and try to relax your muscle, your group of muscle from different part of body. Every time you try to breathe in and you tense your muscle, maybe start with your hand, then after you hold for a while, you let go very fast and you breathe out. So you try to do with your hand muscle, your shoulder, your head, your neck, your chest, your stomach, and your leg. So you can do from different group of muscle. You breathe in and you tighten the muscle, and you breathe out, you relax immediately. You can do this by a few cycles and you will find that you are more relaxed. The last one is the imaginary. Imaginary means you find a relaxed place and you try to imagine the place, the area, or any location you have visited in the past that make you more relaxed. And slowly you add in more detail into the image. The sound, the smell, the voices, what you can hear, the bird sound, the wave or the sea, and slowly add more detail into the images. Whenever you have created the images, try to capture it in your mind and give it a word or it a term. So whenever you are in stress level, you try to relax yourself, bring in the term or bring in the word and bring you back to that image and try to relax your mind. After you have relaxed your mind, slowly open your eye and count 1, 2, 3 and come back to the reality. So one of these way, normally if you have practiced it very often, it will relax you when you're at a very stressful level. The second one is learn to balance. So there are two things we need to balance. One is, of course, we need to work. We have job or we have our duty in the day. We try to build our mastery. So you need to enjoy and find satisfaction in your work to get the mastery feeling or effect. After work, try to shut everything down from your work and try to build out a lot of positive experience. What kind of positive experience you can build up? You can do some activities with your family, with your children. Try to have more physical contact, like hold your children's hand, hold your wife or your husband's hand when you go out. Try to build up the positive experience or feeling afterward. So we need to have the balance of this both, the building up the mastery, which will improve your confidence level in the work, and afterward you need to build the positive experience to get yourself out from all the distress or negative emotion accumulated over the day. Third thing is you can do some self-talk, because nowadays we tend to be very pessimistic. We tend to think very negative. A lot of time we will ask ourselves, what if tomorrow this thing happen? What if tomorrow the COVID getting more? What if tomorrow I lost a job? So in psychology, in mental health profession, we always ask you all to, since you like to ask what if, why not you try to ask yourself what if not? All the time we like to ask what if. Why not you start today onward to ask what if not? What if not, it will not happen? What if not going to happen? Since you like to question what is going to happen, why you don't ask what if it's not going to happen? So do a lot of self-talk. Think about the benefit side and ask some question to challenge your negative thought. This one I will skip. The last one, the thing we can try to overcome our stress is to learn to solve the problem. In psychology, we do not encourage you all to run away, avoid the problem, but try to solve the problem. So by solving the problem, we always give you a mnemonic, the ideal mnemonic. Ideal mnemonic means try to identify where is playing in your mind that always keep you occupied and cannot relax yourself. So after that, you try to develop a list of solution about the problem you are facing or encounter. So go through the list of solution and check the pro and cons of the solution. Then you decide on which is the best way to solve the problem and take up the action. Don't just plan and think. Take up the option. Lastly, then review back what the action, the outcome of the action, whether it's helpful or not. So this is one of the way we can solve our problem that cause all the distress level. So when face fear, we are lived with a lot of uncertainty. So we always have to resume our life-orientated or life focus through our process of faith, love, and hope. To maintain the optimal level of hope that will help us to live with uncertainty. As I promised, I say one of the breathing technique is called mindful breathing technique. So I think a lot of you have exposed or have learned or even have attended a lot of courses of mindfulness. So this is just a recap. So it's introduced by Kabat-Zinn. Kabat-Zinn also learned this mindfulness from the meditation or from the monk. What is the concept of mindfulness is human beings tend to have a lot of monkey thought. We tend to think a lot in the past and we try to predict the future. This makes our mind very uneasy and very distressed. So a lot of time we've forgotten about where were we, where are we standing, and what is the emotion and what is the experience at the current moment. So in the mindfulness breathing or mindfulness relaxation technique, we always encourage you all to be mindful at the moment. Whatever your experience at the moment, we pay attention on purpose in the present moment without any judgmental thought. We do not resist, we do not react, we do not reject. We just let it happen and let it experience, and we let the moment, let the thought, let the experience, let the feeling flow in our body, and do not do any discrimination or any rejection or any analysis. This is a very good example. Just compare the human and the dog when they're taking a walk out from the house at the park in the early morning. You can see the man in their mind is full of a lot of random and a lot of irrelevant thought. But somehow the dog mind is just exactly the picture in front of the dog, with the sun high hanging in the sky and 4 trees in front of the dog. So for the man, it's called mindful of random thought. For the dog, it's just a very mindful thought. So this picture always reminds us, why are we always at the stressful level? We are so distressed. Are we forcing ourselves to think a lot of unnecessary things whenever we are at a very peaceful, very calm, and very relaxed situation? Do we enjoy, appreciate what we are doing every day? Do we enjoy what we have every day? Or we try to destroy all the peace and comfort mind by filling our mind with a lot of future expectation or a lot of trauma, unhappiness from the past. So this one we need to rethink back ourselves every time we go through the stressful condition. So before I end, I just want to ask you all to avoid a lot of bad habit in your daily life. Try not to deny the problem, but identify problem, try to solve the problem. Don't try to keep things to yourself. Try to talk to people. Try not to avoid thinking about problem. Face the problem. Have a wishful thinking. Do not use something dangerous to numb your feeling or to avoid thinking of the feeling. Don't blame or criticize yourself. Try to praise, try to recognize what you have done every day. Keep extra busy, make yourself occupied with a lot of activities. It will make yourself more distressed. So not to do all these things too often in your life. Try to counter it with, try this, accept the problem as is. Decide what you can do and what you cannot do. Plan and take action to solve the thing that you are suffering or encounter in your life. Look for advice, information. Try not to keep things to yourself and try to solve it yourself. Change your perspective whenever you see something is not favorite to your expectation. Away your feeling, understand your feeling, not to avoid or try not to keep it aside your feeling, and always seek support or help from surrounding, from your friend, from expert, or from any colleague. So with this, I hope you can achieve a stress-free soon in life and have a good well-being. Thank you very much. Thank you.
Thank you, Prof. Ang. That was a very, very useful presentations actually to give people tips on how they manage their stress, and also to understand the fact that stress is important and it is part and parcel of our life. Now, for those who joined in later, I would like to let you know that this symposium is supported by Pfizer Malaysia, and we are using the theme Unpause Your Life Today, which means continue to live life despite all the stresses in our life that we have, or whatever barriers and hiccups that we come across. And these symposia are actually here to make sure that we live and we learn and we thrive from there. And without further ado, I would like to introduce my next speaker, another eminent speaker, Dr. Felicia Chang, who is a palliative care practitioner, and she's going to talk about pain management and give us some tips on pain management. Over to you, Dr. Felicia Chang.
Okay, so hi, thanks Ranjit, and thank you BCWA for your invitation to give this talk. So we are talking about managing pain in metastatic breast cancer. So first of all, I would like to say that a lot of people, when they have cancer, they are very afraid about having pain. But what my message here is, we can manage pain. Most of the pain we can manage, so that you can have a good, still have a very functional life, still have a very good life, that we are able to do the things that you love to do. So let me continue with my slide. So we're just going to talk a little bit about the statistic about pain management. We'll talk about type of pain, how can we deal with pain, whether we can use medication or non-medication, and how has a pain impacted patient and their family. And there are a few questions that I received earlier that I would like to just slot into the slide. And at the end, how can we support patients and family in dealing with total pain? So we know that in the world incidence, this statistic is a bit old, but it still holds. So there are about, in 2002, there are about 1 million diagnosis breast cancer, and 400,000 deaths from it. In Malaysia, it's about 1 to 20 lady will have breast cancer in their lifetime, aged between 40 and 49. And it takes a while for people to seek help, either because it is a lot of stigma, a lot of fear, a lot of what do you call that, fear to see doctors, and ignorance. Okay, so unfortunately, there are about 40% still presented to us quite late at the late stage. So pain, let's talk a little bit about pain. Pain, we have about 53% in all stages, either you are stage 1 to stage 4, 53% of them probably have some kind of pain. But we see that the percentage goes very high, especially when they are very advanced or they are having metastatic cancer, which means the cancer has spread to other organs. Okay, so a study done by a palliative care team, then 89% of our patient actually has pain. So, and out of it, 43% is not being treated well. So the question is like, you have pain, we have the medication, and why are pain still being so fearful, and why is it not being treated well? So let's talk a little bit about the cause of pain. So it can cause by the tumor itself in terms of its sizes, and also if it is the cancer has spread to elsewhere, for example, if gone to the different organs, or it infiltrate into, that means it's eaten it into some nerve. So, but it also can be caused by treatment. Like for example, if you have a surgery, the surgery itself can cause pain. And if you have a chemotherapy, many of you would have gone through it when you're having, especially the platinum base, you will have some kind of nerve pain over the tip of your finger. And of course, radiation can also pay for having pain. For example, if you're having some radiation to your lower spine, but it goes through your stomach, you can have abdominal pain. And of course, they are also pain from other treatment when you try to use other treatment in conjunction with a conventional treatment. So let's talk about the pain. So everybody thought pain is equal, is the same. But we have known for years that pain is, we can have different type of pain. Okay, pain is a very big, like a very big subject, but then we have different types. So we talk about somatic. Somatic pain basically is the pain from the organs. Either it is a hollow organ, visceral organs, for example, it can be pain from your stomach, your esophagus, or we can have pain from the muscle, the bones. But one of the things that people are aware but not very sure what it is what we call as a nerve pain or a neuropathic pain. Okay, so what are the different causes of this different category? So for musculoskeletal pain, it can comes from the tumor itself. For example, someone having what they call that, a tumor in the bone, or secondaries, or let's say, for example, you have cancer, breast cancer, it has gone to the bone, then it can actually cause the bone pain. So it can cause by fracture or immobility. For visceral, if in the later stage of some of my patients who have liver involvement, so the pain where the liver is when it becomes bigger, it stretches the capsule and it causes a very annoying pain over the right side of your abdomen. So it can, because of the gastric stasis, it could be from the medication. Sometimes when those of you are taking morphine, oxycontin, Targin, those medication causes stomach to move very slow. So you have problem with constipation and all that, and that can also cause pain. And of course, if it goes into your, if it's in the brain, it can cause a different type of pain, and the description is a little bit different. So some of my patients say it is burning in nature. Some of them say that it is like, being sliced. So that kind of description point us towards the neuropathic pain. And neuropathic pain or nerve pain, usually it travels. It from the place of origin, it can actually travels down to the different part. Example, if you have a backache, it can travels up to your leg. So the message is different type of pain. Actually, we have different kind of pain medication, but the most importantly is how much of pain history that we get from our patient. So pain history basically is trying to guide us whether it is the pain rising from the visceral, musculoskeletal, or is it the nerve pain. So we have this, some of you may have quite familiar with this, what we call as a visual analog scale. So sometimes we ask the patient to give us a score, so it becomes very objective in managing pain. One of the way is like when you ask a patient, if you are a very elderly patient, you say, oh, I cannot tell you how much is my pain score. So, we give them the picture and say, okay, in this 6 picture, where are you right now? So for example, if they pointed towards this, then we know it is moderate pain. But if they're pointed at this, that means the pain score of 10 means they're in severe pain. So having a pain score helps us to guide us how to help you. For example, if you have pain of, for example, 8, I gave you some medication, 15 or 20 minutes later, you say your pain score dropped to 2. So we know the medication is working. So this is this is one of the way that we actually assess pain. All right. So of course, after the history, we would like to examine the around where is the painful area. So so we do try to find out where is the pain. For example, you say, oh, the pain is in the abdomen. So we will examine your abdomen. Probably sometimes we do some x-ray to find out whether it is something serious that we need to deal with it. So all this help us to actually find out the source of the pain. Blood tests, sometimes if there are bone involvement, so what happens is like we can have problems like hypercalcemia, very high calcium, which can actually causes a very painful situation. And that blood test will give us a guideline as, oh, if it is hypercalcemia, let's just treat the hypercalcemia and bring down the pain. And of course, the other thing is to find out all the investigation to find out the source of the pain. So yes, we have pain. So the thing is like sometimes we will like to deal with the cause of the pain. So if let's say I have a metastatic cancer, breast cancer patient having severe pain over the bone, all right, we know of by identifying the cause. Okay, so this cause is by fracture. Okay, so if it's a fracture, the question right now is, can we fix it? So if is surgery or radiation able to fix the problem? But if not, then we will treat the symptom. But if we can find the problem, then we'll treat the cause. So for example, the fracture, if you can fix the fracture by a surgery then we will do it. But let's say they say surgery is too dangerous for the patient, then we probably not go that way, and we treat the symptom with medication. So some of the pain management, that if we have a very huge fungating wound, sometimes we can do a surgical removal, we can do radiotherapy, or we can do chemotherapy to reduce the size of the tumor burden or the size of the tumor. For bone pain, we have different medication. We also have Zometa. Some of you are familiar with pamidronate or zolidronate, that is to reduce the calcium level in the blood system, and thus it reduces the pain. The liver, we will use a lot of steroid too to deal with inflammatory pain like liver capsular pain. But of course, we cannot run away from morphine and its family. It's called opioids group when the pain becomes severe. And nerve pain, this is a very interesting nerve medication. A lot of our nerve medication are not actually being started off for pain. For example, we have gabapentin, right? Gabapentin is actually anticonvulsant. We use it to control seizure, but in our patient, I use it to control nerve pain. So some of the other thing is like a TCA, like amitriptyline. Amitriptyline is started off to use it as antidepressant, but we use this antidepressant to control pain. So a lot of time when we started a medication and other doctors are not very aware of why we started this medication, they'll say, oh, this is for antidepressant, you're not depressed, so don't take the medication. So explaining what type of medication and why we are using it is important, so that the other doctors or other family member who like to Google sometimes will know why we start certain medication. And if the pain is bad enough, certain centers like or Selayang, they do nerve block to actually kill off the nerve so that you don't experience the nerve pain anymore. So for treatment-wise, we use opioids as if the pain is very, not a lot, So if your pain score is 1 to 3, very mild, we probably use a little bit adjuvant, Panadol. But when the pain becomes very severe, that's where we start to use things like tramadol. We use things like morphine, fentanyl for severe pain. So the principle of pain management is, a lot of people say, oh, only when you have severe pain, only you take your morphine. But we know the source of the problem is a cancer, and if you are not, if the doctor already said that we cannot remove it and we are treating the symptoms, it's best to actually have a regular pain management. Means that you take your medication by clock. Means that you take it by 4-hourly or 6-hourly. All right, and then we use this very small dose, then we go up to the very high dose, and we always try to use it using oral medication rather than injectable, unless the pain is extremely severe. Okay, so of course we are talking, this is very much medical, so I'm just going to run through it. Okay, so for some of the pain, this is some of the common medication that we use. Okay, if you just go through it. All right. Okay. So let's talk about pain medication that we don't need to use drugs. All right. So of course we're talking. I mentioned about the surgical debulking. We're talking about palliative chemo or radiotherapy. But managing good wound. If you have a very bad wound, good wound management helps in pain as well. And managing using mindfulness. Prof mentioned about breathing exercises using mindfulness. So this is one of the destructive therapy that we can use when you are in pain. So we can use medication, but those who are very fearful of using medication, we do use a lot of complementary or supportive treatment. Okay, so so that's one of the question that Ranjit actually sent it to me is can we use other medication? Sorry, other ways to treat pain management. So let's talk a little bit about complementary and alternative treatment. So a lot of my patients use acupuncture to help in pain, especially nerve pain and muscle stiffness. But I practice a medical acupuncture, not the one, the Chinese medication acupuncture that you use. She told me this is very good for hot flushes as well. So for acupuncture, the only cautious thing that we have to look out for is one is if you're in infection, we can't do it. All right. And if the if you have low platelet, if the cancer have gone into the bone marrow and you have very low platelet, you have bleeding tendency, then we don't do it because the needle may actually cause more bleeding. So we also use aromatherapy. So massages, diffuser, gentle massage help in reducing tension and swelling. Okay, diffuser, if you put in a diffuser with a different aromatherapy, for example, for relaxation, it will relaxes your mind. So for herbs, some of my patient uses herb to try to help them with their pain. So some of the things that they uses is like Sabah snake grass and porcupine. So these are the things that was never been investigated, and we do not know how it interact with your treatment. But let's say the Western side or the conventional side say, oh look, there's nothing we can really help you with. I actually, if my patient comes to me and tell me that they're using that, I have no problem with that. It's just that I always say that, okay, we do not know about the research. So when you try that, let's give yourself a timeline. If you try it for 2 weeks, if within this 2 weeks you have more problem, then stop it. And if it is not helpful, please stop it, because we really do not know how it works. A lot of people say, oh, but Chinese traditional medication has been there for thousands of years. I do agree. It is something that the China has been using a lot as well. But the problem is how pure is your herbs? Are the things that because when you plant it in a different setup, it may have a lot of what they call that heavy metal toxicity. So be very careful when you use herb, but please always talk to your doctor about it. And medical cannabis is coming out very, very much in Malaysia as well. It's in the world. All right. So medical cannabis is marijuana. So we have been seeing patients using it a lot for pain management and relaxation. The only thing is, like, if you're using it, inform your doctor. Whoever prescribed the medication or medical cannabis, please, you have to talk to them if there's any side effect or adverse effect. So I think I don't have much time, so I'm just going to do one case presentation. Then we just give you an illustration of how do we deal with some of the pain. So let's say Madam C is diagnosed with CA breast in 2016, had a mastectomy followed by chemo and radiation to the chest. They found a lump later, 2 years later, investigated as bone mets. She said no to chemotherapy. All right. So she came back 1 month later and said that, oh, there's a severe abdomen pain and backache. So investigation, did an ultrasound, we found a liver mets and worsening of the bone mets. So for her, probably because of the liver capsular pain, I'll give her some steroid for a week and then we start to cut it down. Of course, when you're taking steroid, there is a risk of gastritis. We cover with some gastric medication. PPI means a proton pump inhibitor is for your gastric. So then we look at the bone, he's getting weak, probably the bone is pressing onto the spine. So we give some, the steroid also help to reduce the numbness and the weakness over the leg. And of course, for the bone pain, I use Celebrex. For the nerve pain, I use gabapentin. But ultimately, we give a radiation to the spine. And once the pain is settled, we start to reduce our pain medication. Okay, so I will just skip this. So the message is pain management is very individualized. Okay, so we must be able to balance adequate pain management with quality of life. Because if when you're in pain, there's nothing much more than you want to do than just sort out the pain. You don't want to think about other things. And we know well about our pain and pain management. And just that I will have to always remind my colleague to reduce the pain medication after the treatment like chemo or radiotherapy. So just a little bit of the impact of disease to, let's say you have pain, okay? How does it impact you? It will have impact you physically, emotionally, spiritually, and socially. All right, so the total of concept of this total pain. So that means when you are having pain, it doesn't mean that only the physical pain. It encompasses all your physical, psychosocial, psychological, social, spiritual, and practical struggle. So when you pain, when somebody is having pain, I give medication. After a while, it doesn't seem to work. So I want to think about what is disturbing her or him. So in terms of total pain. So physical pain, we know that, for example, if you have a wound here, so patient is very worried about the pain, very worried about the smell, worried about the bleeding. If let's say it affected the wound, you have very poor mobility. Of course, if the site is very unpleasant, because most of us, if I may be wrong, but most of the here is ladies, but we do have male breast cancer. But then the site of our breast is having a wound is actually a very distressing site for us. So that's how it impacted us. So emotionally, we may have a lot of fear. We may be very embarrassed to go out. You know, we go into depression. We feel very helpless and probably very angry at sometimes. So that's how pain can, or the disease can impact us. Socially, we could have loss of job, income, you know, we lost of connection with others. So I have a patient who have a stage 4 cancer and have a very bad fungating wound. And because of the smell, she locked herself in the room. So she was isolated from her family. Even though her family and the grandchildren want to approach her, she refused for them to come into the room until we go in and clean the wound, take away the smell, you know, and dress it up properly, dress her, put her on her own nice clothes. Then only she allowed the family to come in to see. So spiritually, there is it's like a double-edged sword. So we can walk closer to God, or we can walk away from God. There's a lot of question, why me? You know, there's lost sense of self-worth and belonging, and lost a sense of purpose of life. So this is how a disease impacted us. So probably this is an illustration as well. So we have a recurrent CA breast with spinal cord compression, decline further treatment. So we discussed her suffering. So when we talk about the suffering in context of the total pain, this is what she told us. That's what I have reflected earlier. So let's say that how does her condition impact her patient and her family and friends as well. So what kind of support is she receiving? Is she grieving financially? Are they okay? So if you look into all this, what I want to illustrate is pain is physical, but it also have other components. So how can we help? How can we help? How can you as friends help? How can you as a patient help? How can you as a family or a medical professional help? We want to understand about, we want to find out how much they understand about their illness, all right? And giving them honest information. But in Asian culture, a lot of patients, elder one, they really didn't want to know. So find out how much they want to know and give them the sufficient information for them to cope, but help their family to cope with it. I think a lot of people say, oh, please don't tell my mother, don't tell my father, or my mother or my auntie they have cancer. But when you have a fungating wound, we cannot run away from the white elephant. So we do, like what Prof says, that we have to address the stress. We cannot run away. So we have to deal with it, but in a kind way, but in a more understanding way. So we want to, let's say you tell me, oh, my doctor didn't talk to me about this. Okay, some doctors are not trained to do this. Look for the appropriate doctors to talk to you about the total pain. Okay, palliative care, we have it in Malaysia, in KL. So anyone who really need to have that discussion can go to a palliative care physician. All right. So this is a message that I really, really love. It is what is written by Cicely Saunders. You matter because you are you, and you matter to the end of your life. We will do all we can, not only to help you to die peacefully, but also to live until we die. So focus on quality of life. So that ends my slide.
Thank you, Dr. Felicia. I think you covered, I mean, you started with pain and you covered every aspect, which was the physical, the emotional, the spiritual, and the social. And I also noticed that Prof. From his perspective of when he talked about stress, it was at the same time also encompassing all this spectrum of of a human being, how the human being actually functions, and how daily life and quality of life is affected when you are going through stress or when you're going through pain in life. And with that, we would like to now open the floor for questions.
How to control the emotion, anger, and frustration so it doesn't affect our health. If we do not control our emotion, our health will definitely affected. So we cannot separate both of them. So first thing I think what we need to understand is we need to identify what emotion issues we are having. Are we getting more easily angry, or are we getting more easily depressed, or are we get more easily frustrated? Identify the emotion we are having and try to acknowledge it. For us human, we cannot have no emotion. Every day we have different type of emotion. You can happy today, you can feel bored tomorrow, you feel angry tomorrow. So when we identify, we acknowledge the emotion, then we try to find out what is the pre-incidents before the emotion. So what happened before the emotion? Are there any specific thing that always trigger the emotion? And subsequently, what happened when we express our emotion? What will happen? What is the consequences after we expresses our emotion? So from there, we try to learn about, okay, this is a triggering factor. As I have mentioned just now, if there is an obvious problem or issues that is always trigger your emotion, we try to identify, try to get a solution, and try to accept or overcome the problem. But some of you will say some of the things we cannot change. My husband always is stubborn, always make me angry. You cannot change your husband at this moment. Maybe you want to change in next life. Never mind. But you cannot change it now. So a lot of times we have to accept and learn how to live with it. So we have to learn how to control our emotion when we cannot solve the problem. To control our emotion, a lot of time is our thought. We always have expectation. We want things to be in our way, to be perfect, to suit our expectation. So when you cannot change the things, you have to change ourselves. We can accept something that is to be beautiful. We can accept something that is very annoying to be very chill and very calm. So we will change ourselves. If you still cannot do it, try to share with people. Share with people. People will explain to you what you're going through. Actually, a lot of people are going through it. People have encountered it. People can live with it. People can even give you other options how to deal with it. So by solving yourself cannot, sharing with people cannot, then you can come and see some expert like us, the psychiatrist or psychology or counselor or some caretaker that have experience of handling this. We can go for higher level to overcome this emotion problem.
Dr. Felicia Chang, I would like to ask you a question. Like when patients come to see you, although you mentioned just now the different types of pain, how do patients, laymen, actually explain the type of pain which you can recognize as to what type of pain? Because they may be using different words to describe it in their own terms and in their own way of description. So I remember when I used to work as a physiotherapist, I used to have Chinese patients saying to me, "Assam, Assam." It was like, nerve pain. So I knew that was nerve pain. So how do you have it now? How do patients describe their pain to you?
All right. Thanks, Ranjit. So as I said, there are different type of pain. So for muscle pain or bone pain is very specific. It's bone pain or it's muscle pain because it's a common pain that most of the patient experience before they have cancer. For example, you had a fall, you have a skin injury. You can describe it quite well. I think the one that a bit hard to describe is the nerve pain. All right. So I don't ask my patient, do you have nerve pain? I usually ask a very open-ended question and say, okay, tell me about your pain. So as what Ranjit said, some of my patients said, oh, I have this pain here that feel like it's burning. So my Malay lady will probably say, oh, doctor, macam sini macam cili lah, sakit dia macam kena bakar. It's a burning type of pain. Or somebody will actually tell me that, doctor, tapi ada macam semut lari sini, lari sana. So it's associated with numbness. So with that description, so we can put a point that most likely it is related to actually nerve pain. So for the liver capsular pain, because it is it is an organ, the liver is over on the right side of our body, our abdomen. So for bone pain or muscular pain, it's quite easy. They would point with one finger, or the pain is here, the pain is here. But when they are having pain that is very diffuse, they would go to the stomach and they use their palm and say, oh, this is the pain. So it's not one finger to point where it is. So when they say, oh, the right side, it is this. So I know that it is not bone pain. I know it is not nerve pain. So probably it is a visceral pain. So I have to do my clinical examination to confirm my suspicions. So these are the few things that they really describe. But I think more than the pain description, I think it is the score. Pain score is a bit difficult. So a lot of people, when you ask, can you tell me how much is your pain score? They will say, I don't know how to tell you. So we can use the analog, the facial visual analog, but sometimes we don't have it. So I would ask them, okay, when you are having pain, 0 to 100%, what is your pain level? So they say, oh, my pain level is 30%. So I say, after the medication, how many percent does it drop? They say, oh, it dropped 20%. So I know the pain medication works for 20%. So sometimes we just have to use very common language when we want them to do the scoring. I hope I answered that question, Ranjit.
I think it was very well answered. And I mean, because yes, as medical practitioners, you have your own terms and your own way of doing things. But with the layman, the communication becomes so much better when you understand the layman's perspective, and then you are able to translate it into the technical side. And thanks, that's very well explained. Now there is a question much earlier, the first question that was posed, which is to Prof. Ng, and also Felicia, you can also add in from your side. Is it better for cancer survivors to change to a less stressful job for those still working? What is your comment on the Prime Minister, a cancer survivor, or some CEOs, also cancer survivors, who are taking up huge responsibilities or stress in their work?
So I think, as I mentioned in the very beginning, it's very subjective whether we should say we should take a lesser stressful in our life after, not to mention about cancer, any kind of illness. A lot of time I tell my patient, when you are at the critical state, you tend to want to stay away from the stressful work. But after you come out from the critical condition, you are more fit, you are calmer, you will feel regretful if you quit your job or you change to another job. So don't do things impulsively when you're not at the right mindset or at the very painful period. Try to solve the symptoms, get yourself out of all the distress emotion or physical symptoms. Then only you decide. When your mind is clear, you are pain-free, but you still feel that life is more comfortable with a less stressful work, then you go ahead. But don't make the decision when you are at the critical state. So the answer can be yes or no, but it's up to you. It's always up to you. Yeah, Felicia,
I think I agree with what Prof said. So don't make rash decision when you're in pain or when you're undergoing stress, because if you're it's really up to the support that you may be able to get from your employer. For example, I have patients that are still working when they're doing chemotherapy when they're in stage 3 or stage 4. The reason is because the company or the colleagues are very understanding, the boss are very understanding. So try to rope in people around the office to see where you are. But I can understand also, because some of my patients also come and tell me and say, oh, but they always think that we are seeking for attention, we are seeking for compassion, we want things to do it because we are sick, we are the sick one. But I think if you are a person with before that already have a good work professionalism, I think that will not be an issue. But get help around you, especially at the workplace. And people are very compassionate, but sometimes it's just that we don't tell, we don't ask. All right, but let's say that you really cannot get away and you have nasty co-worker, your boss or your company doesn't understand. As what Prof has said, just just take some time off. You have leave to do it. So when you're doing treatment, you actually were given leave. Those time is then when you come back, you see whether your body, your mind, and your spirit is able to cope with the work stress. If not, then maybe it's good idea to actually move on. But we also have to depend. You know, sometimes when you move on doesn't mean that you're going to get the same salary. You're going to start all over. So you have to also see your living condition. You know, this is kind of lifestyle I'm having right now. If I quit now, if I look for another job, I may have to change my lifestyle. Is this some exchange that you're willing to do? So just like Prof, what he said, yes and no. So it's really up to your own understanding and how you make the decision based on information that you have at that time, that point of time.
Thank you, Dr. Felicia. I know that Prof Ng has to leave very soon. I think there are a couple of questions. One is, how do you know that you're in the green zone? And also there's another one about how to control emotions. I thought Prof Ng had already mentioned how you can control by the various exercises that you were teaching just now. And it was also mentioned women are emotional, always easier said than done. Okay, do you want to answer those questions? I think you had already given the answers. And there was somebody who's asked, what if you're already in the depression stage with pain? And I think maybe the one we can give to Felicia later. Prof Ng has to go off for clinic, and so maybe we can get Prof Ng to give his answers.
Yeah, I think I agree with the questions addressed to me. A lot of times it's not so easy to do compared with just to say it. But don't give up hope. A lot of time you try one time to share with your family member and your colleague. They didn't get the message. Maybe they just to brush it under the carpet and say, just don't think about it. Everything in your mind, everything will be better. Try to share with them again, give them chance, because they are not in this discipline. They don't see cases like us every day, so they don't sit down and listen to you. Okay, give them chance again when they are not so busy. Tell them what you are going through. I don't believe that your family member will take it so lightly if you keep on telling or sharing with them what you are going through. You have to make them understand. For them to understand your feeling, it will take a while. Sometimes I feel that we give up on our family or our support system just because the first time we're being rejected. So please persistent. I think some care, some love is surrounding you. Sometimes we just oversee or overlook it. And there's always hope. So sorry to say I have to leave already. My clinic is running. A lot of patients outside.
Thank you, Prof. Thanks very much.
Thanks,
Take care.
Prof.
Thanks,
See you,
Felicia.
Prof.
Catch up with you next time. Bye.
Catch up with you. Bye. Bye-bye.
Okay, Dr. Felicia, there is a question that they get into, what if already in depression stage with pain, with emotions and physical, how do we find a way to, besides medication? I don't know, maybe do they have a problem accepting medication? Or they sort of like think that that's addictive?
I think there's a lot of stigma. I think there's a lot of stigma when someone starts to take a medication to control the anxiety or the depression. So society hasn't been very kind to a patient or family or whoever they have some mental, what they perceive as mental illness, but probably it is something that we need to address. Because let's say, for example, I'll give you an example from medical professional, like in different country. For a palliative care physician to see a psychiatrist because we do have burnout, and to just talk things over is very common in overseas, in Europe, in Australia, in America. But the moment you come to Malaysia and say, oh, a palliative doctor go and see a psychiatrist, oh, should I go to see her because she's a little bit, out of her mind. So I think there's a lot of perception. Seriously, I think there's a lot of stigma that stick with those who are taking medication. So your question, does taking medication cause fear. Yes, I think it does. It does. And in general, in Malaysia, or as much as I understand that people are so scared of taking medication because they thought if I take medication, my liver will go, my kidney will go, you know, I go into organ failure because of too much of medication. But so let's come back to the question of if we are already on a depressive stage with pain and emotional and physical, all right, how can we find help? All right. So depression is a clinical diagnosis, means that you have to be assessed by a psychiatrist to say that you are clinical depressed. And if you are clinical depressed, you will probably need some medication. But that medication need not be the only way for you to help you to cope. Some of us already have a medication, but we are still having this depressive thought, this negative thought. So how do we overcome that? So what Prof says is finding support, the ability to share it up with somebody, your loved one, okay? Some people may not want to share with the family, with friends, with counselor. So the ability to, it is an energy that is built up in your body. So once you share it up, you feel lighter. So you find ways to cope with it. So when we ask our patient in the hospital, for example, are you coping? Are you well? Are you? Then my patient said, I am not depressed. I'm just low mood because nobody supported me. Then we talk to them. Okay, what kind of support will you think will be very helpful for you? So we say, okay, if somebody to talk to, somebody to be able to share my burden, then we check who is there for you all this year. So what we are trying to do is not giving answers, but we are trying to let them tell us the answers. Like for example, this Manli is asking, okay, we are already in the depressive stage. Is it depression or low mood? First of all, is it a clinical depression or low mood? If it's a low mood, we want to find out what is the way to cope. The coping method, as Prof has said, that identify your stress, okay, then develop list of solution, all right, and then evaluate the pro and cons and action plan. So you have a plan here. So let's say you find that you're depressing because everybody is talking about negative thing all the time. Then remove yourself from the source of your stress, okay? Think of a positive time. Read more. Okay, read like the cancer survivor book, all these books, or encouraging thing. Bring in happiness into your life. A lot of people will say that but I can't do this because I don't have the capacity to do it. I don't have the heart to do it. Then find somebody who have gone through it to support you. I think that's where the breast cancer support group is. They have gone through it. They have gone through the low mood, and how did they cope? So they can guide you. They can help you. So I think for me, you have to first of all separate a clinical depression from low mood, all right? And if there's really need a medication, I suggest to take it because it really helps in elevating your mood. So antidepressant work by elevating your mood. So once your mood is better, then you find other coping mechanism to support you. Eventually, if the coping mechanism is strong enough and you have a strong support team, you can slowly taper off and then remove your antidepressant from the picture. So I hope I answered that question.
Yes, Dr. Felicia, because what I realize is that you are incorporating, besides the pharma involvement, which is the medication, it's also to develop, to help yourself to develop positive coping skills that can help you to move forward in terms of your social, your physical, and your emotional status. So, I mean, there's a thin line between making out whether it is a clinical depression or whether it's just feeling low. So that also that the patient herself should be able to identify where she stands from some of the areas that Prof. Ng had mentioned as to not able to focus, not able to do certain things, or getting irritable more easily than normal. So if you're beyond your normal and you're doing this, then it's a problem. And also the other thing is we would like to ask you also about the fact that sometimes when a certain drug, like for example Xanax, they feel good with that, so they're able to sleep well at night, because there's a lot of sleep problems as well in this kind of situations, whether it is pain or it is a stress incorporated issue. When they have that, and then they sort of like want it more regularly, because then that induces sleep for them. What happens, like in the long term, does a person continue to need Xanax, something like Xanax, or can the person taper it off and go for something else?
Okay, so we are talking about Xanax using as medication to help to sleep as well as to reduce anxiety. All right. So first of all, we have to identify the problem. Okay, why are you on Xanax? All right. It could be, okay, let's talk about sleep. I can't sleep, so Xanax help me to sleep. Okay, then the question is like, why can't you sleep? Is it related to the symptoms, or is it related to your thinking, or is it already a problem in the past? So I have a lot of patients on Xanax, okay, when you ask them, they say, oh, even as a teenager, I probably sleeping, I have insomnia problem. So it is a very long problem before they have this illness, but Xanax help them to sleep better. So the question right now is, if you have identified the problem, for example, my patient can't sleep because of pain, I control the pain, I don't need the Xanax anymore. So let's say I usually start on a very low dose of Xanax for sleep if they have pain, because I know that once they can, the pain is controlled, I can actually remove the Xanax because it's still very low dose. Okay, so identify the problem, why you can't sleep. If it is the pain, if it is breathlessness, if it is a nausea and vomiting, you treat the symptoms, okay, then the sleep, you have good sleep. Secondly is, if let's say they say, oh, I don't know, I don't have pain, I don't have symptoms, I just cannot sleep. Then you want to ask, is this something in the past, you have a similar incident? Is it that you, since teenager, you can't sleep? All right, probably they say yes, the answer is yes, in the past I can't sleep. So you know this is a long problem. Then you want to ask, in the past, have you taken any sleeping medication? If no, you want to ask, how did you cope at that time? Then you say, oh, probably I read something, you know, I watch TV. So you use back whatever they used it earlier to help them to sleep and try to cut down your Xanax, okay? But let's say they say, oh, in the past I have no problem, and right now I don't have symptoms, I just can't sleep. And then for 3 days I can't sleep. The next day I become very nasty. The next day I become very groggy, because the next day I feel like sleeping. So for me, I will break the cycle by giving them 5 days of Xanax, then I take it off. All right. But now come to a point of those using long term. So it really depends on the disease trajectory. If some of my patient is already quite advanced, I don't control the Xanax because I know that help them to sleep. But let's say if they are in the stage 1 or stage 2, or they are actually cancer survivor, I will probably teach them different method to help them to sleep, because there are many methods. Meditation, we can go through mindfulness, we can use music therapy, we can use aromatherapy, we can use massage therapy to help them to sleep. So the thing is that if you have very short prognosis, I don't care how much Xanax you use, because we don't have much time. I just want whatever remaining time to be comfortable. But if it's a chronic problem, I don't want you to be addicted to it, to be dependent on it. I will use other method to try to help you. But if all this fail and you still need Xanax, and I use it in cycles, I mean, like, okay, you can't sleep, okay, just take 3 days, stop. Then for the next 2 weeks, you're okay, but the next time it happen again, then we take another 3 days. So I pause it, So by using Xanax to sleep, these are some of the things that I do for my patient. But so somebody has anxiety, okay, so anxiety is a very different thing. So anxiety can have purely anxiety, or they can have bipolar anxiety as well as depression. So that one is under Prof side, I think they would probably need to have a different medication, but it's just purely anxiety. Then I would want to find out what triggered the anxiety and what are the things that can calm them down from the anxiety beside the medication, and I'll focus on that. There will suggest things other than that to help them to deal with their anxiety. So if they have anxiety attack, okay, I will use Xanax. But if they are not having the anxiety attack, they're a bit kanchong here, a bit kanchong there, So I will try to find a way to help them to cope with their day-to-day, and how can they actually, human is very strong. Actually, we are very resilient. We are very resilient people. I always advise them, look deep into you. What gives you the strength? Whether it is religion, whether it is friends, whether it is family, look for that thing within you that can help you. Don't keep asking people to help, because external thing can disappear. But if it comes from within, I think that is the best place to start with and to continue with, because that's where you can build yourself up. You can be positive, you can be happy. It's a choice. So we have to help them that there are many options, and this is the choice that probably will help you more. As I said, we are all facilitated. I can't tell my patient what to do, but I can give them suggestion or things that my other patients have gone through or I have used before. So I hope that answer your question as well, Ranjit.
Yes, certainly, Dr. Felicia, because what you're talking about is a very personalized situation where each person is so different and you need to look at it differently and work around it. And also the other thing is you very clearly mentioned that we are very resilient creatures, and we definitely have resource within us that we can use. And we at that time are blinded by it. When we are going through these issues, we are blinded by it. We cannot see it. We need people like you to sort of try and get that out of us. Now, the other thing that I would like to add here is that the fact that when, I mean, we've got like 40, at least up to 40% cases of metastatic breast cancer diagnosed in this country. And particularly when it comes to younger women, when they have very young children, toddlers, for example, and the woman is just recently diagnosed with metastatic disease. There's a huge gap when it comes to the right services for her, because a lot of it sometimes gets focused on the medication part of it or the treatment part of it in terms of this physical. But when it comes to psychological, there is a gap. Of course, we provide peer counseling, we provide peer support, we listen to them. And of course, then after that, we need peer counseling. We need counseling as well for professionals to debrief, particularly when we lose somebody, you know, that's when we need debriefing. So the thing is that huge gap, what would you suggest would be important? First of all, in Malaysia, one of the things that many metastatic patients have problems with is financial when it comes to treatment, particularly innovative treatments. The second part is the fact that their children are young, and will they be able to live long enough to be with their children? And these are the two main, you know, they have their significant others, they're responsible for those people, they want to live on to be there for them. So what is your advice? What would you want in an ideal situation in the country?
Okay, I mean, in terms of treatment, actually, to be very honest, we are very blessed because I work in a private sector. So we have a lot of foreign people coming in to get treatment under the, what I call it, Tourism Malaysia. And and countries like Thailand, countries like Indonesia, right? They have to pay for everything, you know, even if they are under public hospital or government hospital. So for our hospital, for our Malaysia, our system, as much as they have their own flaws, all right, but if you have cancer, if you have no money, government won't leave you alone. I mean, like, government will abandon you. So they are still government set up to go to where you can seek treatment. Comparatively to many other countries, it is quite cheap, all right? But we are talking about B40, those below B40. There are always government side, public side to be able to help. So I think if we have family member or we have patients that are not cannot afford and they don't have insurance, I think the government side are doing their very best. And I interact with my government oncologists, palliative, and they are doing amazing job. Yes, they have very heavy workload. So the expectation is like, you know, I don't get the best treatment. No, you're actually getting the best treatment in the government. It's just that the waiting time, the area of where, you know, where you go may not be 5-star hotel, but to seek treatment for cancer, we are still one of the best in the region. So I think that the mindset of shifting, you know, government is no good, but public is good, it's not true. I think government side is doing fantastic job in terms of giving you the medication to cure your cancer. So coming back to the second question about the young lady, I mean, like, we have a lot of young ladies with very young family. Nothing is ideal, okay? So I think that's also another thing. Expectation is like, you know, okay, we cannot, I mean, like, everyone look in Australia, do they have the best one? No, they don't have the best medical support system. Do they, UK or US? Because in terms of culture, in terms of accessibility, in terms of connectivity and how do we work with the government, I mean, how do we go with our colleague is different in different region, all right? So for those ladies, of course, ideally, I would like to have, you know, a surgeon who's doing the surgery, the oncologist who's going to help with the chemotherapy. You know, we have a child psychologist to help with the child. We also have a psychologist to help with the mother, you know. And of course, we need the palliative care to manage the symptoms, or, end of life care. And that would be ideal. Everybody in the same room and say, okay, let's have taste discussion. But we know that in terms of resources, we wouldn't be able to have that. Everywhere is shortage. But then what can we do? Okay, so we know we can't have the ideal one, but what is the other best thing that we can do? For example, this lady, okay, to be able to communicate with the child. Okay, so when she's in a hospital, if if there's a palliative care team, seek help from the palliative care team. So we in palliative care team, we are trained to deal with families, because we wanted to, if you look into the definition, it's not only patient, it's also include family. So we are trained to talk to the family. I'll give you a very good example. I have a very young mother who is I think 30 plus, just nearing 40, and she have very young kids. We're talking about 12 and 9 years old. Okay, then during hospitalization, we went through with her, okay, how's the child, they want to speak to the child. So we have a lot of session with the children as well, either through play therapy or either through art therapy, or we just sitting there talking to the child or allowing the child to talk to us, all right, while the father is there, all right. So once the mom died, okay, passed away, then we continue with that kind of counseling and supporting the child and the husband, which is part and parcel of grief management for the palliative care team. So there are things that we can still do. Let's say, for example, if I felt that after a few sessions, the child is not doing well, but we know that grief is not something that we put a timeline. They say, oh, within 1 year, you have to be good, right? We can't put that because everyone is different. Grief never leaves us. We always have grief. It's just that how the grief affect our day-to-day activity, but we don't put a timeline. But if, let's say, I've seen this child maybe for 3-4 months and I say, I'm not getting anywhere, probably then I will call up my child psychologist and say, oh, call Prof and say, hey, do you deal with children? This child is having grief issue. Will you be? So I will always redirect them to somebody who can follow them up for a longer term. All right. So this is how we work with patients and families. So be open. A lot of families say that, oh, I don't want my children to know. I don't want them to be burdened. But children are very pure. Children are very sensitive. The moment you don't tell them something, they will think something is very suspicious. They want to know more. So instead of pushing them away, get them involved, but talk on the level of a child, using play, using art therapy, using child psychologists to be able to engage them and see how they feel. All right. So for me, it's like I'll do what I can, but when I can't, I will always ask help from a colleague who have that kind of qualification to help. As for the mother, just like what I've presented earlier, symptom control. Okay, we go into looking into what is meaningful in her life, what kind of legacy that she wants to leave for the children. We do video recording for mothers. We do art with the mother. We ask the mothers to write letters, for different what they call that life timeline in their child's life. When they graduate, with their birthday, for their wedding, when they have their first child, and all that can be planned when the child, when the mother is still well. But once they become very ill, it's very hard. So early connection is very important. Early engagement is very important for young mothers, so that we know it's a metastatic. All right. However much control that we want to give, we know eventually one day they will have to face end of life. All right, and that timeline is very precious for us to engage with them and create memory for them and create memory for the husband, late husband, husband or the child once they passed away. So, yep, that's my experience, Ranjit.
Yeah, Felicia, I was just thinking life is not a bed of roses that everybody wants the roses all the time. There'll be times of roses and thorns. I remember doing a training program for women with breast cancer in Pahang at one time, and it was in Bahasa because they were all women from the kampong. And I remember we were doing some group work among the women, like small group work. And we had given them mahjong paper and marker pens. And, when you go to kampong areas, the children, the whole family comes along. Mm-hmm. So, everybody is there. And I remember one of the children picked up a mahjong paper, took a marker pen and went to one corner of the room, and he was doing his own things. In the end, what we saw he had done was two faces. One face was the mother crying, and he said, "Mama menangis," and then the other face was Mama. That was Mama sedih, and then Mama ketawa. So we asked him what it was about, and he was shy to talk. But later on, he managed to say that when Mom was first having the disease, she was very sad. Children, like you say, are sensitive. They can make out, they can know something is wrong. And then now he knows his mom is well, and he's expressing that. And I think if children are allowed to express at every milestone or touch points of their mother's life, it will be great to see this whole. I would say it's evidence. It's you can develop into a manuscript. You can just do a whole paper on it, which is extremely interesting, simple but so good. Thank you, Dr. Felicia, for explaining so explicitly. And I do agree with you that when we compare ourselves with other countries, our healthcare system is so much better. We still have tertiary centers that provide services to early as well as advanced breast cancers, but we will still continue to make sure that there is more and more provided, but of course, one step at a time. And I would like to thank you very much, and also to thank Prof. Ng for his session. Again, I would like to remind all our audience that this session is supported by Pfizer Malaysia. And this session is called UNPAUSE, which means unpause our lives. You unpause your life today. Don't stop your life. While you are breathing, your life is still going on. So while you're doing that, you must live. While you're living, you have to learn. We learn every day, and then that's how we learn how to thrive further in our lives.
Thank you, Doctor.
Yes,
Thank you very much.
Thank you, Doctor, for
Thank you very much, Ranjit. Okay. Bye.
Hello.
Thank you.
Thank you, Doctor.
Bye. Bye.
Bye. Thank you very much.
Thank you.
Bye.
Thank you.
Thank you.